Hi, everybody. Welcome to Habitual Excellence. We are joined today by Samuel Ashby. He is the Director of Performance Excellence at Legacy Health. Samuel, how are you today?
Hi, Mark. How are you? Good to be
Great.
here.
It's great to have you here. And, we're going to touch on some themes. For those in the audience who attended the Lean Healthcare Transformation Summit, or those who are familiar with Catalysis as an organization, they recently did that virtual summit, and Samuel gave an excellent talk. Had sort of two titles, and I think that'll be maybe the starting point for our conversation here, Samuel. We talked about, it was teed up as fostering a resilient culture, but then also the theme of resiliency as a team sport. Can you first off define resiliency and sort of touch on those things? How is this, how can this be fostered in the culture, and how is it a team sport?
So, yeah, that's very interesting. I think what happened was that there was already a predefined theme, which was fostering a resilient culture. And I took a pivot from that and actually decided to talk about resiliency as a team sport. And the reconciliation didn't happen in terms of what got presented out in terms of brochures and on the portal itself.
Okay. Yeah, and that wasn't a criticism. It was just I thought it raised a couple of different interesting things for us to think about as an audience. So how do you define resiliency, and is that a common definition within Legacy Health?
It's a common definition. I have maybe a little bit of a different view on resiliency in the sense that we want people to be resilient for, in my sense, a defined period of time. Otherwise, it's essentially a containment that lasts forever, right? Or could conceivably last forever. And you think about what's happening with COVID right now. People are being asked to be resilient, but at a certain point, from a timing perspective and from a load perspective, it starts to lose its efficacy. And then you start to see what we see right now, which is burnout. So I think, there's obviously some, kind of preventative things that you can do to address kind of what some of the things that I talked about in terms of your individual mindset and how you approach things. But ultimately, we have to be able to respond to the need. And that's going to always be the biggest challenge, in my mind, with the definition of resiliency.
Yeah. So one thing I hear you saying, maybe we can explore a little bit more. You used the word containment, which you and I have roots originally at the beginning of our career in the automotive industry. You at Toyota, me at General Motors. We were trying to emulate Toyota, and but for some in the audience, that word containment might not have the same meaning when it comes to, let's say, quality issues. So I was wondering if you could elaborate on that a little bit, and maybe also elaborate a little bit on being reactive versus being proactive when it comes to resiliency.
Yeah. So when we talk about containment, how we define it for our team members here at Legacy is to essentially stop the pain of the harm or the risk of harm that is of immediate threat either to themselves as a employee or to the patients themselves. And then to stop that potential spread of that particular issue to an area, and then ultimately to the house. And so that's how we define it. And again, it's really about, we kind of use a term that got coined by Jose Bustillo. That's kind of the rule of more, which says that if we need more people, if we need more time, more inspection, whatever it is that we need to ensure quality and controlling the zone, that is the thing that we absolutely have to do.
And that containment and that more strategy is meant to be temporary until a more systemic fix can be put in place. So what parallel would you draw to the way people are feeling in the workplace, whether we frame it as resiliency or else?
Right. I think that you hit nail on head, right? And that the piece around containment, it is, again, it has a shelf life. And so it's never designed to go indefinitely. It's designed to have a period of time, and once that period of time has elapsed, then we should have a long-term countermeasure in place. And I think that's where we are today relative to resiliency. We've kind of tapped out the amount of time that we've been able to ask our staff and our and even our leaders to continue to bounce back day after day after day.
Yeah. So the ability to bounce back, I think you also used a phrase in your presentation, being able to recover from change. I was wondering if you could just share some more thoughts along those lines.
Yeah, and I think, again, if we take COVID, that was a sea change moment. And again, not even just a moment. It was obviously it's still going. And here it is 16, 17 months later. And I think, that ability to be able to respond to change. So how we operated pre-COVID versus how we operated within COVID and still continue to this day is totally different. How we break, the number of people that we have together in administrative offices. People are now working from home. Staff are now more on Zoom calls. Like all of those things have been fundamentally changed. But I think also too with that change, again, as we go back to time, it has to have a defined end. Or something to countermeasure or balance that experience. And I think that's where, a lot of our team members are trying to figure out what's that counterbalance. And I think organizations are trying to do that too, but it's multifactorial, right? And it's sometimes very different for very different groups. Mm-hmm. And I think that's, that complexity makes it a unique problem, but a problem nonetheless that we need to take an attempt to solve.
Yeah. And so when we talk about solving or, at least somewhat alleviating this very complex problem, like you said, people talk about burnout, unfortunately, so much in healthcare. And, it's just interesting to think through how to address this systemically. It's not enough. Let's say I hear complaints sometimes about people being sent to resiliency training as if the problem is them, that they're not resilient, as opposed to eliminating some of the causes of burnout or some of the stressors. What are some of the ways you're trying to address that more systemically there at Legacy Health?
So obviously, we talk quite a bit about safety. And I think I mentioned this in our conversation with at the summit, that we talked about safety in terms of physical safety, psychological safety, and professional safety. And obviously, we want people to feel extremely comfortable in coming forward and when they have issue or have started to reach their point. And again, it's a two kind of sided thing. It's not just the expectation that the employee does that. We also ask our leaders to create space and to inquire to see how people are doing and how people are coping. We've also put in wellness rounds, which is something that's got started here at Good Samaritan. And those have started to spread across the system, particularly with COVID. And that was really just to go and check on staff, because one of the feedback pieces that we got was that people weren't seeing senior leadership, either operational senior leadership that was attached to the site or senior leadership that was responsible for the system. And so those wellness rounds have been, again, a point of relief. We've even done things like, if you can believe this, have baby goats. And baby goats are surprisingly a hit. So you get to feed them through a bottle and hold them. And that has been one of the most popular things that has helped people kind of lift their spirits.
Wow.
Crazy.
So it's sort of like a support animal that's visiting.
Yes, in some ways, yes, but I don't think that's the intended thing. It's just, kind of like just, here's 5 or 6 baby goats, come pet the baby goats and take a photo with them. But it's probably been at least 4, if not 5 of our 6 adult campuses.
Wow. So there's not goats roaming the hospital.
No, that's
but that's a creative way of bringing a little bit of joy to somebody's life and to their work environment. So here, and you know what, I should have had that ringer off. So I'm gonna just go back and do an edit. That's the first time in a long time I've made that mistake of
no worries.
Not being muted. Sorry. Let me just leave a little silence. Okay, I'll create an edit point after wrapping up the goat
okay
thing. Okay. So Samuel, maybe we can come back and talk a little bit more about what you're doing in the workplace. But in your summit presentation, you talked a little bit about your time as a child and learning about resiliency. I was wondering if you could share a little bit about that with us here.
Yeah, I'm happy to. So, as I said before, I grew up in Louisville, Kentucky. And Louisville is an interesting city in the sense that a lot of people that are outside of the South consider it to be Midwest. But we ourselves consider ourselves to be Southerners, and there's a lot of the kind of Southerner racial dynamics that come into play as a young Black person growing up in a city like that, where everything starts and is predicated by race first, and that decides kind of where you're slotted out in life. And so, my parents really kind of taught lessons that were not necessarily unique to any Black family that was particularly in the South, which was, you have to be twice as good. You have to show up dressed and presentable. You have to be able to communicate in a way, in a form and a fashion that is succinct and intelligent and helps people to understand your technical capability. You also have to be able to not take these slights personally, which seems weird, right? Because it, kind of happens to you individually, but you have to kind of understand that rather than take this thing personally and it might cost you to quit, you have to also understand that there's all of these other people behind you. And so moving forward is really about moving forward, not just for yourself, but moving forward for anybody else that comes behind you that looks like you. And so, that was just something that my parents just continued to kind of hone in, over and over and over again. And also too, kind of the humanization of the pieces that, ultimately you have to be loving, right? You can't, Black parents constantly have to raise their kids to do two things. One is to hate the system, right? That is white supremacy and everything that comes with that. But love the people that may physically look like that system. Because you can't, if you hate that thing, then there starts to become this cycle. And this is a common, as I said before, a common conversation that's had and a dilemma that's had amongst households that have Black children. And so that was something that was really instilled very well in me, and just allowed me to be able to navigate.
Yeah. And so then, as we came into 2020, trying to be resilient in the face of the pandemic was one thing. That was a big challenge. And then again, unfortunately, this is not by any means a new problem, but coming to the forefront was, I think, a greater awareness and discussion of systemic racism, the murder of George Floyd and the killings of other Black people in different circumstances. There was more of, maybe not even just a national conversation, but in some cases workplace conversations. So I'm curious how trying to be resilient in the face of all of that last year was something that was talked about at work, because some people might not feel comfortable talking about such things in the workplace, right?
Right. Yeah. And I talked a little bit about this. Well, a lot about this, last week. But Breonna Taylor's murder in particular was a very, very seminal moment for me, because she was born and raised in Louisville,
Right.
was an EMT, was, wasn't a criminal, but was treated as such, and then subsequently murdered. And for what all intents and purposes appears to be at some minimum level an effort to suppress what happened. And so I think, as I started to find that out, that was just, kind of like, wow. Because that really hits home. And, I've had interactions with police officers as a youth. So it just, for me, it was just kind of like, kind of a big moment. And I think, there wasn't a lot of conversation there at work about that specific murder, because at the time it was kind of local and regional, not necessarily national. It hadn't reached that kind of national stage initially. However, when we got to George Floyd, and that obviously was, again, another seminal moment, I think it did create this this experience where you had a lot of people, and people of color and allies, that were deeply, deeply affected. And there was another group that didn't know how to broker those conversations. And I think, the conversation I had with my leadership team after Jose, John, and Brad and I had that discussion was that just ask if people are okay. Ask them how they're doing. Like, that simple ask and that creation of space can create an opportunity for people to just share it and to release. And that doesn't necessarily mean you need to be an expert in anything that happened, or necessarily even have an opinion at some level. But just to be able to say, hey, how are you doing, and recognize and to see that there is a risk or actual harm that this person may be experiencing. That opportunity and creating that space, I think, is just a really, really great first step. And so I think once I kind of explained that started to happen, where leaders were starting to ask either reports or team members that they had of color, kind of, and those that are known allies, kind of like, how are you doing? How are you coping? And just creating that space. And so I think that was a really, kind of allowed us to be able to start some of the other work that we did, which is policy language around becoming an anti-racist organization, as well as language around biases, as well as affirmative action and harassment policies and discrimination policies. And so that kind of created that space to have the conversation, and then turned it into policy. And now we're starting to, figure out what are the processing systems that will allow us to be able to meet the expectations of those policies.
Yeah. And some of the listeners might not know, Samuel mentioned Brad, that's Brad Toussaint, John Coladora, and Jose Bustillo, who are all part of the value capture team on site. They're working with Samuel and the legacy team. What you say there about just having the empathy, taking the time, creating the space to ask, how are you doing? That reminds me of, or it makes me think of what you were talking about of the leadership rounding around wellness, and certainly one aspect of wellness. How are events either in your community or in your hometown or just nationally that might end up affecting you?
Yeah.
What is that, putting a cloud over somebody, and how do you create the space to at least let someone express themselves? Or you're not really going to fix anything by having that conversation, but it's kind to let someone have that space to share how they're doing, right?
Yeah, I think you have to start to get to know these individuals, right? And particularly those that don't necessarily look like you or come from the same background as you, right? You've got to dig deeper into forming and understanding those relationships. And from what I've learned in the 5 years that I've been here at Legacy and in healthcare, relationships are such a big part of the healthcare industry that most people of color don't have those relationships. And so when these things happen, it's difficult to know what is potentially impactful to that individual if you don't have a relationship with them and don't know who they are.
Mhm.
And so I think that's, some of the work that we as leaders have to do with our teams. And sometimes it's, understanding where people are on certain initiatives and meeting deadlines is, yes, it's definitely important, but sometimes just the check-in around how they're doing, and just really kind of hearing that and, understanding what I can do as a leader to be able to counterbalance some of those things, whether they be personal or at work. Those are the things that are meaningful.
Yeah.
Yeah.
And it sounds like, getting to know people and creating those relationships, to me, you could frame it Toyota language of respect for people or respect for humanity. You can frame it, Shingo principles that say a little more directly, respect every individual,
Right.
as a foundation for anything that we're going to try to accomplish, whether it's creating fair and just workplaces, fair and just society, or even tackling issues where systemic racism comes in related to healthcare quality and outcomes, and trying to connect those dots. So I was wondering if you could share a little bit more, Samuel, on how lean management approaches, or I know as you're calling it, the legacy operating system. How do some of the problem solving approaches maybe help us attack really important, complex, sticky problems?
Yeah, this is a really good question. So one of the things, we obviously have started to have our own conversations internally about the experience of Black people and Black team members here at Legacy, and one of the questions that I asked was, how can we employ A3 thinking on this problem? If we believe that this approach is powerful enough to be able to deliver, or potentially deliver zero harm to our patients, why wouldn't we be able to use and apply this to something that's really complex, that we know it's could have far-reaching effects? And so I think that question initially kind of caught people off guard. It's kind of like, wait, how, it's not a process. It's like, how do I frame this up? Because it's always been about process, and it's like, no, it's really about thinking, right? And so, and it doesn't necessarily have to show up in a process. It can be, even if it is a process, it's not maybe as neatly as confined as you would think in what your traditional healthcare process is. But that said, you still want to be able to understand how that thing happened. That's the only way that you're going to be able to solve it. And yeah, I think we're starting to kind of move in that direction, but again, it's been one of those things where I feel like it's not something that we would normally apply. Mm-hmm. And I think just because of that, it caused us to kind of pause a little bit. But I feel like we're on track. Yeah.
So getting that discussion started, what I hear you saying is, I guess people had to get their heads around the use of A3 thinking and getting comfortable with some of these uncomfortable but crucial conversations.
Right. Yeah, because, going to understand current condition, how do you have that conversation with team members? How do you give those team members confidence that that they're safe to be able to share what's going on? Like, all of those things are just hugely important, but there may be things that translate a little bit differently than what we would traditionally think, but they're still translatable.
Yeah. And I heard you articulate in your summit talk a goal for Legacy Health of being correct me if I didn't get this exactly right. Safest place to receive and deliver care.
That is correct.
As a goal and objective.
Yes. And so our aspirational goal is to become the safest place to receive, to both receive and to deliver care, with a goal of having zero harm for physical, psychological, and professional safety events for both patients and for employees. And so that's also been an interesting conversation, because as you well know, in healthcare, it's about, being better than your immediate competitors or being in the 90th percentile, and that conversation of zero harm, that, I think initially kind of put people on their heels, to say, well, like, wait, what are we actually saying by that? And it's like, well, we're saying that we don't want anyone to experience these things. And I think that kind of, this, kind of game-breaking thinking that seems to be game-breaking for healthcare is something normal and natural for most other industries, right? We always operate at the theoretical limit. And so just that transition of trying to think about this at that theoretical limit, I think was good conversation and good discussion. But it allowed us to be able to start to get alignment on kind of, saying that, we only have 40 CAUTIs out of a year. But then when you start to humanize that by saying, okay, so there's 100 people in this room, which 40 are we telling that they have CAUTI? That kind of forces the conversation into less about serve rates and all of these other things, but about real humans that are going to actually experience an adverse outcome. And that helped to kind of push for, more of an embrace around, this does need to be zero.
Yeah. And that's something we believe deeply and really try to advocate for as a firm, as value capture, of encouraging leaders to set goals at the theoretical limits, but then work together with people to improve the systems, not just setting this goal, and because that could pressure people into keeping quiet about issues. So it requires that openness and that transparency and that collaborative leadership. I think all of the things that Lean or a legacy operating system inspired by Lean and Toyota methods would help equip people to do that. And maybe one other thing I thought we'd explore here, I think there are times where I think people unfortunately get a little bit resigned to the current reality being the way it has to be, whether that's infection rates, being dismissive of near misses. Well, we'll re-educate someone, we'll tell them to be careful. Like, that's maybe not a great containment strategy. And I can imagine there's parallels where if somebody reports being mistreated or disrespected or discriminated against in some way, that leaders shouldn't be dismissive, or like that. The need to come in and contain a situation, I guess, is one way that helps prevent further degradation of the system. Is that fair to say?
Yeah, I think that's very fair to say. And this is something obviously that's constant work for the HR teams, particularly as as we've started to learn more about how to have engaging conversations with people of color and people of different orientations. That said, I think we're starting to see some fruit and some benefits of that, in the sense that it's, again, kind of opening up space, and it's helping managers to be reflective on their previous actions, to say, wow, maybe I didn't create the space that I thought I may have created, or set the right tone previously, and they can start to do some things around acknowledging that happened and apologizing it, and then stating what they're going to do on a go-forward basis. Additionally, if the employee doesn't feel comfortable and registering the complaint with their one-up manager, they can go over to the manager one above that. So, for example, if one of my team members had a complaint that they wanted to file against me, but didn't feel comfortable raising it with me, they could actually have the conversation with Lisa Gorin, who's the Vice President of Organizational Effectiveness. And if they didn't feel comfortable in going to Lisa, they could go directly to Sonia Steves, who's our Chief HR Officer. And so that is another mechanism that, again, creates spaces of safety that allow team members to be able to report things that they don't see as what we expect to happen. And again, can help get containment because we have to understand the facts and the pertinent information, and that we want that to move really, really quickly.
So it sounds like there's a couple dimensions to all of this. One, doing general rounding of asking people how they're doing and inviting that conversation. But then it sounds like there's sort of a continual effort to encourage people to speak up and to make sure it's safe for them to do so.
Right. Yeah, you got to create it at both ends.
Mm-hmm. Yeah.
Right.
So one other thing I just want to touch on a little bit before we wrap up, we could probably do a whole separate conversation about this sometime. I mentioned earlier you started your career at Toyota. They're in Kentucky, right?
Yeah.
I'm curious to hear maybe at least one reflection about working in healthcare, or maybe to frame it in terms of what advice would you have for somebody else who's sort of following in your footsteps of coming in from an outside industry to help work on these really important challenges in healthcare?
Yeah, really good question. I think the first thing is to understand that these lean principles, though not absolute, they are transferable. And if you can see them as transferable in the sense that they, the kind of the scaffolding of the concept is transferable, and then there's some fine detailing relative to environment that you can make, then I think it allows you to be able to really understand, how to be able to translate the Toyota production system or some lean operating system over into the healthcare environment. Because I think these healthcare processes are really complex, and obviously they, the just nomenclature alone is a challenge. Mm-hmm. But I think, I would say that, and the use of rules and use. The use of rules and use, and for those who don't know, is Decoding the DNA of the Toyota Production System by Stephen Spear and Kent Bowen. Mm-hmm. Just a brilliant article, white paper about how to diagnose issues in processes, and then also how to design countermeasures that would close those gaps. And so really kind of coaching leaders on the use of those, that rules and use is also helpful as well.
Yeah, and we've talked to Steve Spear before on the podcast, and I'll make sure we link to that article, Decoding the DNA of the Toyota Production System. That's freely available from Harvard Business Review. And I encourage people to check that out if they haven't already. Because, so I'm curious, so, Steve Spear and Kent Bowen were outsiders, academics who had a lot of access to Toyota over a period of time. But the rules in use was their, I guess, way of summarizing or encapsulating thought processes that might have been more ingrained as somebody like yourself who was inside the company. It sounds like that did resonate with you, though. You're reading that and like, okay, maybe that's not exactly how we described it, but that totally makes sense.
Yes, absolutely. Absolutely. And it's so funny because the first time that I had ever heard of the term rules and use was in 2012 with one of my lean coaches that has really been a great resource for me, by the name of Mike Murney, who worked at Toyota Production Canada. Just a really great lean mind, and he had showed me this, and I read it, and I was like, yeah, that's what we were told, but we never codified it that way. And so I think that was really kind of the difference. You would just kind of, kind of trained and told to do and perform in that way, but it was never kind of codified. And so the seed of codification was really interesting, because that's something that you just kind of naturally do, but it was great for teaching. And so we're and to be honest, in ways that I couldn't do, because the only thing I could do is kind of describe in this kind of oral way that may have not really had the level of functional thinking that it needed. But this article did that. And so that's the, kind of the really great magic in it, to be able to share that with people as you start to kind of train them on how to be able to think in this manner. Just really, really great.
Yeah, that's great to hear. So maybe we do another episode down the road and sort of explore some of this a little bit deeper and talk about some of the other transferable concepts and principles coming from the outside into healthcare, as you've been able to navigate that so well, Samuel.
Thank you. Love to.
Okay, well, good. Well, our guest again today has been Samuel Ashby. He's at Legacy Health. He's the Director of Performance Excellence. Thank you for sharing some of your thoughts and reflections and lessons here with us today. Really appreciate it.
Thank you. I appreciate the time and again the platform and the space.